Hey, it's your friend Tammy, and welcome to Resonate with Tammy podcast. Today's episode is on mental health. First episode on mental health. Joining me to discuss this topic is Dr. Lee Abbess David-West. Hello, Dr. Lee. Please introduce yourself to our listeners out there.
Hi, everyone. My name is Dr. Lee Abbess David-West. I'm a medical doctor based in the United Kingdom. And I'm very, very happy to be here today. Thank you so much for this privilege.
Thank you for coming. So tell us about depression. Most times people always use the word I am depressed, but they're not depressed, they're just sad. So can you just tell us what depression is all about so people will know what depression is?
Okay, well, depression is a mental health condition. It's characterized by a persistent low mood. Now, all of us at some point will feel low at some point. You feel unhappy, you feel sad for a couple of days. But for depression, it's different. It's a persistent sadness, and it can last for weeks or months. So there are other names of depression. You can call it clinical depression. It's also called major depression, or it can also be referred to as major depressive disorder.
Okay.
Yes, so that's basically a definition in a nutshell.
Okay. According to Forbes Health article on depression statistic in 2024, that approximately 280 million people worldwide live with depression. I had to read that again. Why is depression on the rise? It's shocking. That statistics is shocking. 280 million people worldwide living with depression. Wow.
Yes, that's actually quite high. I don't think a lot of people are aware of this. In fact, to add to what you just said, WHO, the World Health Organization, they project depression to be the leading cause of mental health illness by 2030. Okay. In fact, a study is not too recent, but it's still something quite important to look into. But there's a study that suggests, the study was done in 2016.
Okay.
And it suggests that over 7 million people in Nigeria suffer from depression.
Wow.
Yes. So it's on the uprise because I think we're all very aware that in our daily living, compared to how things were before, things are different. Everywhere, everyone wants a piece of you. The media wants a piece of you. Your workplace, they want a piece of you. You're on the home front, they want a piece of you. Everybody's under a lot of pressure, a lot of stress, high expectations, some of which are even unrealistic. So that has added to the uprise. Yes, in the prevalence of depression going on now, especially among the young people.
Yes, it is shocking.
Very much so. Many of them can't find jobs these days. There's a lot of expectations from them from school.
Even teenagers too. Even teenagers.
Very much. Yes. Because let's not forget that being a teenager, it's a transition phase. Many of them are trying to understand who they are, to try to know who they are. Okay, so that in itself is stressful enough as it is. And many of them don't have support on the home front, and even in school. So there's no one to actually talk to if they're having challenges or difficulty in, many aspects of their lives. So it's a lot. There's a lot going on, and that has pushed people to be at greater risk of developing depression.
Why are many people reluctant to seek professional help? They'll say, when I said this to someone once, like, why don't you go for therapy? Say, blood of Jesus. I reject it. First thing, I will not go for what is that, rather pray. But therapists and psychologists are out there to help people that are struggling. So why are people reluctant to seek professional help?
Because
they're afraid of traumatized or something?
Yes, actually, you're really right. That is the one I would have at the top of my list, sincerely. Widespread stigmatization. Okay, it makes people very reluctant to seek help, and many people don't want to express how they feel because they don't want to be perceived as weak. It is not good enough to say, you feel sad, you feel upset, you feel unhappy. Get over it. Don't be weak. Just forget about it. But no, It's just not good enough. It is a legitimate mental health condition, a very serious one at that. But a lot of people are not really aware of it. They don't take it seriously. They don't consider it a genuine health condition, mental health condition. And they consider it a sign of weakness as well. And there are many people who actually know it, don't know where they can get help. There's a lack of access to healthcare that can address depression if a person is going through that. And then, even if they do have the access, many people can't afford it. It's actually quite expensive for many.
Wow.
Yes. So these are the factors that come into play. And let's not forget our culture, religious reasons. Many people just don't consider it. They don't consider it as an actual health condition.
They feel it's spiritual. Yes, it could be spiritual, but then they also need help too, professional help.
Yes, the thing is, a lot of people don't know that there are specific people trained to help people go through depression and come out feeling better. We'll talk more about that, I believe, as we progress in the program.
Okay. Yeah. Is depression gender specific? Because I heard of postpartum depression that newborns experience after childbirth. I also heard about the baby blues. Why does this happen?
Okay, well, let's start from the very beginning. Depression affects everyone, both male and female. In fact, because men are taught to, internalize a lot and, everything like that, many of them go unnoticed when they're depressed.
Okay.
But statistics show that women are twice, it happens more commonly, 50% more in women than men. So they're twice more likely to become depressed than men. And yes, many schools of thought attribute this to hormonal fluctuation. When a lady goes through her usual biological cycle, and then what happens when women get pregnant, when they deliver, so there's a lot of, they ride the hormonal pony, as the case may be, if you don't mind me using that expression. So, and then let's not forget, it tends to be, most schools of thought believe that it's more for women because women have, many of them are not as independent as they would like to be. So there's no security, no financial security, no job security. And then these days, many women are career women now, but they're still expected to perform on the home front.
That's so
much. They come home, they have to take care of their families, they have to manage the home, but they still have careers. They try to make ends meet. So it's a lot of work. And then it can be too much pressure. Then let's not forget that women are also considered to be part of the vulnerable group, along with children. Yes. So there are more, men get abused as well, both physical, emotional abuse, but women are more vulnerable to this. So that in itself can make the female gender more at risk of becoming depressed 2 times more than the men.
What are the triggers and symptoms of depression?
Well, depression arises from a complex interaction of social, psychological, and biological factors. Okay, very strong, significant, life-changing events like bereavement, for example, or a traumatic occurrence like a road traffic accident where a person was a victim, or armed robbery, you witness an armed robbery situation, or unemployment, or a person is let go of a job that you're using to take care of your family for sustenance. Yes. And then let's not overlook one very major factor: disease, cancer, mental health conditions. Yes, but let's boil it down to the one everyone knows: cancer, heart conditions, general ill health that many people, diabetes. These conditions can be lifelong. And they cost a lot of money to manage.
Yes.
It is very easy for people to slip into depression because they're not able to take care of themselves.
Okay.
When your health is in question, it can be very, very upsetting.
Mm-hmm.
And then many people don't have support. They don't have support from family. They don't have support from friends. Yes. So mentally, psychologically, financially, it's a hit. And that can make that, those are the triggers. Now, for the symptoms,
okay,
there are lots of people who are experiencing depression, but they don't even know it. So let's not forget that the depression can be mild, moderate, and severe. Okay. So, but we have things like suddenly not being able to sleep, having problems with your appetite. Some people eat more than they usually would, so they put on weight, so there's weight gain. Some people are not able to eat, so there's significant weight loss, a feeling of guilt, lack of self-worth, suicidal thoughts, not being able to sleep properly. I think I mentioned that already. Not enjoying things you used to enjoy before.
Wow, that's hard.
Yes, so it's a whole list of it. Not being able to concentrate properly or focus properly, or indecisiveness, irritability. Those are symptoms. Those are symptoms of depression, just to name a few.
Okay. And does depression occur in stages?
Well, there are schools of thought that suggest that depression has stages similar to, I'm sure you know, the stages of grief. A lot of people know about the stages of grief, but there's no research that really supports this. I'm of the school of thought that suggests that depression occurs as a continuum of increasing symptom severity. Okay. It can be mild. You just have a few days of not feeling too happy or sad yes. But then again, it can now progress and keep going up until it gets to 2 weeks, 3 weeks, 4 weeks, a month, months. Yes. So I would say it's more like a continuum of increasing symptom severity. That's what I would say.
Okay. And is it hereditary, depression?
Well, actually, it is. So if there's a parent who has depression, if there's a family history of depression, for example, in the parent, that parent's offspring is 11 times more likely to be depressed.
Wow.
Yes. So based on this, such an individual needs to be careful with the possible triggers of depression. We have already mentioned that before. There are life events that happen that trigger. And then these events can actually push a person to self-destructive practices. We can talk about that later. Yes.
What is the impact of depression on daily living?
Oh, it can be crippling. It can be very crippling. And a lot of people don't take this into consideration. It can interfere significantly with your everyday life. It can affect a person so much that they're not able to function. Okay, so they just keep going low mood until they just can't wriggle out of it anymore. They can't. It affects them in their relationships with people, their performance at work. It now makes them engage in what I mentioned earlier, in self-destructive practices. What do I mean? Alcohol dependence, substance abuse, recreational drug use, things like that. Okay. So yes, so that's how far depression can go. Then let's not overlook one very major thing. It increases the risk of wanting to commit suicide by 20 times more than what you would have in the general population that is not suffering from depression. So that means a person experiencing depression is 20 times more at risk of committing suicide. That is how serious it is.
So I hear some people like, this person almost committed suicide. Like, that person is that person okay? Why are they thinking of ending their life? Don't they know that it's bad? They just judge them. They don't understand that they're going through something very serious. So
exactly.
The next question is, why isn't there any awareness about depression in our society in Nigeria? Why?
Well, it still boils down to a lack of understanding of what depression really is. Okay, some people don't take it seriously. They don't consider it a legitimate health condition. Yes, they don't consider it a legitimate health condition, and that's the reason why nobody considers it as something that needs to be addressed, needs to be treated, can actually be treated. And that's the reason why there isn't much done. There isn't much awareness. And then there are a lot of people who don't understand that they can actually come to professionals to help them. Yes. And there aren't enough professionals, mental health care professionals, that can deliver this service. And there aren't enough institutions, mental health care institutions, that offer this service anyway.
Why?
In the first place, because it is not considered as a thing, quote unquote. If it's not malaria, if it's not hypertension, if it's not a stroke, if it's not cancer, if it's not a heart condition, it's not a heart attack, okay, then it is not
Serious.
considered, yes, serious.
If you go to the psych ward, you see lots of women. Sorry, Lee, I'm cutting in. If you go to the psych ward, you see lots of women going through, that going through depression. I mean, I'm like, wow, I didn't know that it was that bad. It's sad.
Yes, it can actually be very, very bad. It's crippling. That's the best way I can describe it. It can cripple you. In fact, many people who go through depression can't even get out of bed.
My goodness.
Yes, they can't even get out of bed because they don't have the will any longer. So what are the symptoms we mentioned earlier? Let's recap.
Okay.
Just a feeling of worthlessness. Okay, helplessness, hopelessness. That person will not have a will to live. There is no willpower any longer.
Wow.
Yes, and those are just a few symptoms. Irritability. And then no one wants to be around such a person. So the person ends up driving people who are close to them away or frustrating their loved ones. Yeah.
So how is depression treated and managed? If we don't have enough facility for this, how is it treated and managed in our society, Nigeria?
Okay, well, there's a lot of work that has been done over the years. People have tried their very best to go into the schools. There are institutions, there are non-governmental organizations that recognize that depression is a significant, legitimate health condition. Okay? And they have done a lot of work to create awareness, but a lot of people are still not really accepting of the fact that it's something that needs to be addressed. Okay, so the treatment, it covers lifestyle changes. Okay. Psychological treatment, let's break it down into just two major bits: psychological treatment and medical. Okay, so the psychological treatment could involve some lifestyle changes, like talking therapy, lifestyle changes including exercise. A lot of people do exercise to keep fit. But they don't actually know that exercise stimulates the release of what I like to call the feel-good hormone. Not just me, a lot of people like to call it the feel-good hormone. So that exercise helps you feel better, helps you relieve stress, because it stimulates the production of certain hormones in your body that gives you a sense of well-being, general well-being. It makes you feel happy, relaxed. That's another thing that exercise does, that a lot of people do not take into account. Okay, so then there are other things like cutting down on alcohol, giving up on smoking, living more healthy. Because if, for example, you engage less in self-destructive practices, you are more likely to, ride the health horse, have a better chance of being a bit more healthy. And that too can help. So those are the lifestyle changes. Now, the other ones, the talking therapy, like something called CBT, that's cognitive behavioral therapy.
Okay.
Yes, the psychologists and psychiatrists, they know very much about this. They are trained professionals. And then there's also the medication. So some people will need a combination of all this. Now, the treatment depends on the severity. Okay. So yeah, some people would just need the lifestyle changes and psychological intervention. But some people need a combination of both, the psychological and the medical. And the medical can involve antidepressants, for example, medications that will help the person cope with the depressive state, depressive mood.
Wow.
Yes. And the earlier you seek help, the quicker you can ride upon the path of recovery.
Wow.
Yeah. It is just not good enough to say get over it.
Get over it.
No disrespect to religion and lifestyle, way of life.
No disrespect to them.
To that.
Yes.
Yeah, so no disrespect to that. But you see, these things are there to help us get better. That's it. Yes. Even church, actually going to church, mixing up with people of the same religion, it actually does help. Yes. Rather than staying in your room locked up. Yes, it does help. There are studies that suggest the validity of such gatherings and how they help your mental state. Yes. So we can't overlook that bit. However, it also encourages people to not seek help from the right quarters, because there are people specifically trained to delve into the richer concepts of the mind. They've studied it, they've researched it, and they're able to bring out those deep inner thoughts that other people are not able to, they're not able to express to anyone else, and get the help they need. Yeah.
Okay.
That's basically it.
Thank you, Dr. Lee, for coming on today's podcast. Do you have any word of advice for anyone struggling with depression?
Okay, well, it's just to re-emphasize the fact that depression is a very, very serious mental health disorder. And it has been responsible as the culprit of people not being able to function in all aspects of their lives if not managed or treated on time. So I would say it again, it is not good enough to say you'll get over it. There is help out there for you. And if you try to seek that help from the right quarters, there are mental health institutions that they are not there to judge you. Legitimate, yes, psychiatry, psychology, they are legitimate branches of healthcare that are aimed to help people walk through. There's a statistic I'm trying to remember what it is. I think WHO was saying something about people who seek mental health or help for depression, like 60 to 80% of them do well. And to me that's a good figure.
Yeah, that's good.
Yeah. And then quite a significant number of people don't actually get the right help. So the first thing is to recognize that depression is a major health problem. It affects women, it affects men, it affects pregnant women, it affects women just when they've delivered. It's there. It's amongst us. And we can't continue to ignore it. That's my take-home message for all of you. So I hope I haven't, succeeded in depressing you further by talking about depression.
No, you haven't. Not at all, Dr. Lee. Thanks, Sam. That's all for us here. Before I go, if you're just listening to my podcast for the first time, you can find me on my content at Resonate with Tammy on YouTube and Spotify. Please like, share, and subscribe, and turn on your notification bell. Remember, you matter. God bless and take care. Bye for now.